Um, so today we have, my name is Cristóbal Cuadrado. For those that they do not know me, I'm a scientist at Sept, and I used to be in this group, THETA. So I think one of the ties with the group now is that I organize some of the THETA rounds. And I'm very, very pleased to invite Cristóbal today for the talk. Cristóbal Cuadrado, he's a visiting scholar from Chile. He's visiting us at Sept, and we're very happy to have him. He's an MD who is currently doing his PhD on somewhere between health policy, public health, and health economics. And yeah, we're going to be very happy to hear about his work on gain taxes, and I think today is going to be a lot of more health policy, and there's more health economics coming in the future. Yes. So welcome. Before we start, we always introduce ourselves to you so that you know who is on the audience. Great. And as we've discussed, you would be happy to receive the questions at the end. Mm-hmm. So I'll start. My name is Pedro Specivaloglu. I'm a scientist at Sept, as you probably know already. And Joanna?
Joanna Bielski. I'm a research librarian here at THETA, and today moderator for our online participants. We have 9 people online.
My name is Letícia. I'm a PhD student from Brazil, and I'm here. I spent like 6 months approximately.
I'm Rafael. I'm a research associate here at THETA.
Justin Thielman. I'm an epidemiologist at Public Health Ontario.
I'm Karen, also from Public Health Ontario.
People, research associate THETA.
Troy Francis, research associate THETA.
Eva, research associate at THETA.
Governmental, visiting PhD student for the
Welcome.
I'm Rafael, a postdoc fellow at THETA.
I'm Ella. I'm a biostatistician here at the RU.
I'm Lauren. I'm a postdoctoral fellow in eating disorders at St. Joe's in Hamilton.
I'm Stephanie Caston. I'm a professor at Ryerson University.
I'm Rosie Payne from University of Toronto, Galalana School of Public Health.
All right, take it away.
So we should be hearing.
Yeah.
So thank you very much for the invitation for this round and for your attendance here. I will introduce you some background work regarding the use of syntaxes, particularly for the improve of the population diets. You know that the syntax has been used for decades in alcohol and tobacco, and that was most of the evidence in public health for syntax comes from that area. But in the last decade, there has been a lot of work coming on, and there's an area of increasing interest for decision makers as a potential tool to try to address the issue of non-communicable diseases around the world. So the overall idea is that we have a project from the University of Chile where I'm based on the Center for Health Economics at the University of York, where we are evaluating the role of fiscal diets on the improvements of diet. This project has 2 parts. The first part is the evaluation of the fiscal policy that has been implemented in 2014 in Chile. We applied a soda tax at that time. So we run a lot of different econometric models to try to assess the impact of the tax in terms of the prices of the sodas and also in the consumption of the population. And the second part is to try to assess what are the long-term expected effects on the population level, so not only in the purchasing, but also in the BMI, diabetes prevalence, obesity, and other cardiovascular related outcomes, to try to assess the cost effectiveness of different policy designs for a tax on sodas, but not only sodas, for also other unhealthy products. In this talk, I will focus mostly on the first part, so I will show you some data of what we have been conducting regarding the impact of the soda tax in Chile. So to start why to use fiscal policy to improve health behaviors? And there are several reasons, and I will through for some of them. So first, poor health behaviors cause much health and possibly economic harm. And just a slide from the Institute of Health Metrics and Relations, this is the global burden of disease, estimates from 2016. The number one cause or risk factor for days lost in the Chilean population is high body mass index, followed by dietary risks. One of the most important of them is the high consumption of sugary drinks. And if we look at the global context, the dietary risks are also the second cause for loss of days around the world. And we have been working in a model to try to assess the cost of obesity in Chile. This economic model used like a Markov design to try to assess the long-term direct and indirect cost of obesity in Chile. And we have found that for 2016, around 2.4% of all the health expenditures are used to treat conditions related to obesity. This is to say that each case of diabetes, for example, that is attributable to obesity is also counted within this fact. This is a similar number for what is found in most of the countries, so around 2 to 4% of the global health expenditures are used to treat consequences of obesity. And in some countries, this rises to close to the 10%, like in the US or Mexico. And there is a common question that I get when I show some of these slides of the increase, for example, in the prevalence of obesity or the increase in non-communicable disease. And the question is this cause for behavioral or contextual factors, or is just genetic dynamics or other intrinsic factors from the population that is not related with, for example, market and the context? And this work is very interesting. It's from this year from Professor Rogers. They have used analysis of cohorts of the US, and they have analyzed the prevalence of obesity from different cohorts across the time. And what they found is that around the period of 75 to the 80s, the trends in obesity prevalence has dramatically changed. You have very stable trends in terms of obesity, but suddenly across all the cohorts at this period, you start seeing differences in terms of the prevalence. So there is a difference in the incidence of schizophrenia at that point. When we see something like this, we are sure that it's not a genetic cause that is bringing this change, but are external factors that are leading. And what happened in this moment is the food industrialization. So at this moment of the time of the context of the U.S. Food market system, there was a very important step forward in terms of the availability of processed foods. And since then, we have been seeing an important increase in obesity and change in the patterns of diet of the population. So it seems to be that there are some important environmental factors that should be addressed to try to tackle the problem that we are looking for. Second, there is economic rationale, there are externalities, and also there are problems with bounded or limited rationality. So it's important to take in consideration that across time, this is also data from the US, prices of, for example, carbonated drinks that are in this line, has been decreasing in terms of real prices, in contrast with the prices of vegetables and fruits that are in this gray thin dotted line that has been, relatively speaking, increasing across time. At the same time that obesity trends for both children and adults has been increasing. There is some literature suggesting that the access to healthy food in most of the industrialized countries is more expensive than the access to more healthier options. And this is data from Chile that we are analyzing. And in this line, that is purple, we have unprocessed foods, so mainly fruits and vegetables, in terms of relative prices from 2010 to 2018. And you see that relative prices for these unprocessed products is increasing much faster than, for example, processed foods that are in the red line or ultra-processed foods that are in the green line. So in terms of the availability for the population, and in particular the affordability of different food products, it seems to be a clear incentive for the population to consume less healthy options, and this has consequences for the overall society, because not all the health consequences of these decisions are borne by the individuals. There are several societal costs, particularly from the perspective of the public health insurance, for example, where we collectively are funding the consequences of decisions from the individuals. So the prices of the food are not rightly incorporating all the external consequences that they produce to society. The same data. And there are also issues of the imperfect information from the decisions of the consumers. You know that it's very difficult to make healthy, informed decisions. Nutritional information usually is very complex to understand. Even nutritionals, dietitians, and medical doctors struggle to really be able to compare products. It's not as straightforward for the population. And more importantly, the consequences of my decisions now are not very easy to see because they appear like 10 or 15 years after. So in this situation, it's clear that the per time inconsistencies, the capacity of individuals to take good decisions in terms of their health is limited. And such situations also occurs in alcohol and tobacco, and that's why some of the rationale in terms of the economics for the application of taxes that try to adjust for these externalities, for example, that are not incorporated within price. And the last point, why to use fiscal policy is because they are effective in reduced consumption. If we have the problem and we have economic rationale, but the consumption doesn't change with the tax, then it's no use for the tax. But the experience showed something different. These are meta-analyses of hundreds of different studies from the case of alcohol and tobacco. There are price elasticity estimates, so how much the consumption change in percentage terms related to a change in the prices. And we see that for alcohol, for example, a 1% increase in the price decrease in 0.44% the consumption of the alcohol. And in the case of tobacco products, it's around to 0.6 the elasticity of the demand. So this increased the idea that the sin taxes could be useful as part of the tools that health decision maker will use to reduce consumption. So that's what sin taxes. And then the question is, if we are seeing a problem in terms of the non-communicable disease and the diet of the population, why we should focus on these particular products that are sodas or sugar-sweetened beverages. And there are a few reasons why it makes sense, at least to start with such products. First, because there is a well-established negative health effects from the consumption. So these are some data from different meta-analyses putting together the causal pathways from SSB consumption to health outcomes. So we know that SSB consumption increases the calorie intake, and that is the most common pathway that is known to affect population. So increase in the calories, increase the body mass index, and body mass index is linked to cardiovascular diseases, chronic kidney diseases, and several others that are not put in this graph, like different kinds of cancers. And also, there are direct links from SSB consumption to type 2 diabetes. So even in cases where we adjust for calorie intake and body mass index, we still found that the consumption of sodas increased the risk of diabetes. And the same is true also for the blood pressure of the population. Even there are some cohorts, prospective cohorts that have linked coronary heart disease and stroke and chronic kidney disease adjusted by the other factors with the consumption of soda. So since that it's kind of established that the consumption of soda is something bad for health. And based on this data, there are some estimates from the US and the UK, estimated, for example, that around 15% of the incidence of type 2 diabetes could be reduced with substantial reductions in the consumption of soda in that population. Second, it's important to take into consideration that the trends in consumptions are increasing for these products. This is the case of several countries, but I will focus here in Chile. This is data from Euromonitor. That is a database for sales of different products, including SSB. And during the 2009 to 2014 period, Chile has shown the larger increase in terms of soda consumption in the world. And in absolute terms, it's also the bigger consumption in terms of kilocalories per person. So if you see the same graph, but for volume, for example, you will see something a little bit different. So Mexico and US will be up before Chile. But when you adjust for kilocalories, you will see that Chile is the biggest consumption. That is not a good first rank to have, but that's the reality. And this is also from the Institute of Health Metrics and Evaluation for the University of Washington. And we see that also the trends from the 90s to 2016 of the estimate for DALYs lost per 100,000 persons has been increasing, but most importantly in Latin America and the Caribbean, where there are some countries that have been increasing largely the consumption of soda, like Chile, Argentina, Brazil, Mexico. There are countries, Colombia as well, that have been increasing very much their soda consumption. And as we have been discussing, this is an important risk factor for the population. Third, why SSB consumption is a good focus? Because of the relative contribution to daily calories and a healthy diet. And we have been discussing this already, that is the Chile's top 1 consumer of SSB by calories per capita. But this is very interesting. This is the national food consumption survey of Chile. And this is the distribution from free sugar consumption in the Chilean population. And 1/3 of all the sugar that a regular person in Chile consumes comes for SSB. This is the same amount that comes from table sugar. So if you take in consideration these two groups, you have 2/3 of the total consumption of the population. So because of this picture, in Chile, we started with a tax on SSB. So that's 1/3 of the total consumption. But now there is people advocating for having a tax on sugar. And that tax that will have another complexities that we can discuss at the end, could also impact sugar beverages and other ones within the list. And lastly, why to focus on SSB consumptions is because it's not necessarily good, and you have already available low-cost substitute, that is water. In most countries, you have like tap water, like it's safe and available and cheap. There are some countries that could not be the reality, but in most of the middle and high income countries, that is the situation. And because it's festival of implementation, it's relatively easy to implement a tax on soda because it's easy to identify what are the products that you need to put the tax on. And you need to, in contrast, a sugar tax, when you need to know the exact amount of sugar that is within each product, that can bring a substantial burden in terms of the implementation and fiscalization of the policy. And that's not the case for SSB. So you remember the elasticities of 0.5 or 0.6 that I showed you for alcohol and tobacco. In the case of SSB, meta-analysis show like elasticities are around 1.3. So when 1% of increase of price occurs, then you have a reduction in 1.3% of the consumption. So are quite elastic in terms of the consumption, and this is for overall around the world, and these are estimates from Latin American countries for the last years, and we roughly see very similar numbers. So here you have again the idea that a tax seems to be a good and reasonable alternative from an economic perspective. This should be the other way around, and my computer was like that. But anyway, this is just a timetable that started on January of 2017 to April 2018, showing different states and countries that have started to implement different soda taxes. So this is kind of an epidemic that is occurring around the world. There is in the US several regions or states that are implemented in, but also in Europe and in the Caribbean, there is an important spread of this policy. Two important cases that I want to bring as a background are Berkeley and Mexico. These were like the two first cases that were studied. They both implemented in 2014 their taxes as Chile has done it. And what they had found, in the case of Berkeley, there are two studies. One that found a 21% reduction in SSB consumption and a 63% increase in water consumption after 4 months implementation. This tax was around 11 and 30% increase depending on the size and the kind of the type of product. It wasn't a plain tax, but it was a tax by ounce, so affected differently depending the presentation of the product. And a second evaluation that found around a 10% reduction in SSB purchase after 1 year of implementation. The case of Mexico probably is the one that has been mostly presented in the news and the coverage. They have 3 studies published. The first that evaluated the effect of the policy at 1 year, where they found a 6% reduction on the soda consumption that they assess after in a second year, and they have found that the reductions continued and increased to 7.6% with substitutions to the water as sales after the implementation. This is the figure for the paper called Chero from Mexico. She was the person that probably has published more in this area from the impact evaluation in Mexico. And after that, I will tell you a little bit of the case of Chile. So in 2014, October, we have a tributary reform. So in this fiscal policy, there were several different taxes that have been changed, not only this one. But we will focus on this that is called GABA. The GABA is an additional tax on beverages, non-alcoholic beverages, that exist in Chile since long time. So in 1933, it started to be in place, this tax, with very stable tax rates across the years. Before 2014, the rate was in 13%. So it was a flat tax based on price. During the tributary reform, there was designed in a two-tiered tax. So for products that was above a certain sugar threshold, the tax increased from 13 to 18%. And for products that are below this threshold, the tax diminished from 13 to 10%. So you have like a relative difference of 8% after the change, supposedly. Importantly, you have a third group of non-alcoholic beverage that is not taxed. That is basically the plain water that is bottled. No flavored, no colored, no sweetener on them. So in the first group, you have like all the like normal sugar representation of the products. In the second category, you have most of the diet presentation of the products, and also powder uses that most of them come to this level. And third, you have the plain water. So what happened after the implementation of this policy? For answer this, we use data from the National Institute of Statistics of Chile. They collect data on stores. It was around 9,000 stores. They collect data every 2 weeks on posted prices for 6 different beverage categories, where we have carbonates, juices, concentrates, bottled waters, energy and sport drinks, and milk. And we used data for a 93 months period from January 2009. That was the longest period that we took that was comparable within it, and September 2016. The analysis for this, we use time series. We're using ARIMA models with exogenous variables to try to account for the autoregressive nature of the series of prices. This is the model. So basically, we use dummy variable that indicates the one period after the implementation and a serial when it was the period before. And we include also a pre-implementation trend and a post-implementation trend, like interrupted time series analysis, trying to assess differences in terms of the slope of the prices before and after the policy. So not only be able to capture a difference in the level of the prices, but also in the slopes comparing before and after. We adjusted for unemployment and other macroeconomic variables that were relevant for the analysis. This is the raw data. So you see that for most of the beverage categories, there is a very stable trend. This is consumer price index, so our indexed prices. 100 is the one, and you see relative changes going up and down from the 100. Here in the gray line, you have the announcement of the policy that was around end of March of 2014. And here in the red line, you have the implementation, where we see important changes. And without any like statistical analysis, we see that something is happening there. So the orange are concentrates. So concentrates, powder, juices, something that I think is not that common here in Canada, but in Chile is very important. So like most low and middle income population take SSB based on like powder juices. In red is carbonates. We have the water that is in blue. In light blue, we have energy drinks that the series started in 2013 only, and you see that they have been, seems not affected at all. And liquid juices that are in the yellow line. And this is the table for the analysis. So I will start from left to right. For each group, first we have the proportion of consumption. So half of the consumption in terms of volume comes from carbonates, just to take like order of magnitude. So carbonates is the main category in terms of soda, and that's why we focus a lot on that analysis. And for carbonates, we do have that all products were in the 13th tax category before 2014. When the new policy started, you have like that nearly 90% was increased their tax, but there's near 10% that reduced it. So the average expected change in price, considering that you have some reductions and some increase, was a 4% price increase. And what we find in our models, I show here two models. The first is a model without an adjustment from announcement. You see that there were some changes in terms of the prices starting at the moment of announcement. So we used ARIMA models adjusted for that, that are on the right, but the unadjusted model from announcement show close to 5% change in observed price. For most of the products, we see an increase in price. And that's interesting because we were expecting in some categories to see a decrease in price. That's the case, for example, for bottled waters and for fodder juices, concentrate. But even in that category, we saw an increase, and particularly a case that it's interesting or a little bit intriguing maybe is the case of concentrates, because we see a huge increment in prices without an expected increase. Indeed, we expected a decrease in price. So some take-home messages of this analysis that we have conducted of the soda tax is first that not always the pass-through or the incidence of the tax is homogeneous across categories. And that is an assumption that is usually done in most of the analysis like this. So like policymakers suspect that they increase the tax for a group of products and they all will increase. And that's not the case. There are like market factors that could explain why some increase and some decrease. And that will affect potentially the effectiveness of the policy in terms of reduction of the consumption of the population. And this graph presents the cumulative effect of the tax. This is the case for carbonates. So in the upper graph, you have the expected and observed prices. And the difference between these two series is presented here. So we see that there is a approximately 5% increase in the price of carbonates, with also a change here that could be related with any other factor, but that comes back to the same line after a short period of a few months. And this is the case for powder juice, where you see the expected and the observed prices, and also the cumulative change in the prices for this series. So one final question regarding the price impact is, do this increase in prices really make products less affordable than before? Because you have to take in consideration that when prices go up in time, also the capacity to purchase of population is changing. So here we adjust for the general income ratio of the country. And you see that when you adjust like average prices for average salaries of the country, you see that in all this period of time, the affordability has been increasing. So between 2009 and 2014, for the Chilean population, buying a can of soda or a water juice has been increasingly easier in terms of their capacity to purchase. This is something that has been shown also in a global scale. And that explains, at least partially, why population could be consuming more. And here it's interesting to see that, for example, in the case of carbonates, we see a reduction in terms of the affordability, that is close to 5% that we see for the prices, but the slope is continually increasing. So we expect that, actually we see that the affordability of a soda can is the same in 2000, at the half of 2016 than it was when the tax was implemented. So in terms of affordability, it seems that the effect is just transient and requires other measures to be able to maintain an effect in terms of the purchasing power of the population. So what we learned from the Chilean case, first, the price effects were heterogeneous across product categories. That is something that has been shown also in other countries, like in most countries in Europe, like in France and Denmark, that they have implemented and have some analysis on this. They have found that there is heavily heterogeneous, and usually carbonates are the ones that increase most their prices, while other categories tend to increase much less, like juice. There should be also precaution in case of mixed policies, where taxes increase and decreases at the same time. And it's important to remember that this market tends to be very oligopolic. In Chile, there are like 2 producers that concentrate 90% of all the beverage market. And that is the case in most of the countries. You have like very big producers that have production across all the different beverage categories. So when you increase the tax for some products and decrease for others, there is potentially an strategic response from the industry where they can choose, for example, in which lines of products they will trespass the increase mostly to the population. In Chile, you will still see several places where the price of a soda that is in the diet version is just the same as a sugar version, even though they have different taxes. And that is clear a strategic response from the industry, because the cost of each of that product is not the same for them. First and third, the change in price not necessarily modify the affordability of the products, and this is something that probably hasn't been addressed enough within the discussion of this kind of tax. In the case of tobacco and alcohol, for example, in several countries, you have taxes that are indexed to inflation, for example, or to another kind of macroeconomic index that allows that the price gets adjusted for the capacity to purchase of the population or the economic development of the society. Then the question of what happened with the consumption of the population. So for this, we have a panel of around 3,000 households from data from January 2011 to December 2015, where with weekly detailed transaction records from take-home purchases, we were able to construct a panel of monthly purchase data. And we conducted a pre-post analysis using fixed effects regression models. This is the model. So again, we have a dummy variable that is 0 in the time before of the implementation and 1 after the implementation of the policy. We have a polynomial hill for time to try to adjust for different time trends. A set of dummy variables to assess for adjust also for seasonality. We included different covariates to adjust for temperature or macroeconomic factors that could also affect the consumption patterns of the population. So first, we're analyzing the shopping patterns of the population. Do consumers change the way they go to shop? And we found that the population tends to decrease the number of times they shop for a soda, around a 7.8% of reduction, with more important effect in the middle income group on also the high income groups, but significant across all socioeconomic groups. And the following table is the effect in consumption in volume. So we divide the products in carbonates and non-carbonates, and we see that for carbonate groups, we find substantial changes in terms of the consumption. So around a 17% decrease in terms of the consumption of carbonates, with also a small reduction in non-carbonates that was not significant in our models. And this reduction was largely explained by reduction in the carbonates that were in the high tax as expected. And in the low tax category carbonates, we expected an increase in the consumption because if you remember, Diet Cokes, for example, were shifted from a 13% to a 10% tax. And we indeed find an increased trend, but it wasn't significant within our models. Please take in consideration also what is the mean for each group. So you see that high tax carbonates are the largest share of the consumption of the Chilean population. So around 3 liters per month is consumed by a person in the country, compared with non-carbonates that is around 600 milliliters. And finally, this is the analysis of all high tax products and all soft drinks, but divided by socioeconomic status. And this is something that is quite different from what was expected and what was reported before in the literature. We have found that for high tax products, the important decrease that we have been seeing of around 20% reduction in consumption was largely driven by high socioeconomic and medium socioeconomic groups, but markedly by the high socioeconomic group. This is different from what has been reported, for example, in Mexico, where the low socioeconomic groups reported much more, and also is different from what usually elasticity estimates tell us, where usually are low socioeconomic groups or low income groups the ones that change most the consumption based in change of price. This is something that we are further analyzing to try to understand what could be driving like high socioeconomic status groups in Chile to have a different behavior to the tax comparing with other countries as I have mentioned. So in terms of consumption, what we have learned, after the implementation, there was a reduction in the consumption of carbonates and high tax products. there were no significant substitutions for low tax categories product categories. So we should see some trends of increase in consumption of these products, but they are not significant. When we transform the relative effects in absolute effects, they are rather small, and that's important to take it in consideration. So I show you the tables of reductions in terms of volume. This was our overall result in terms of sugar, a 14% reduction in sugar intake based on sodas. This is equivalent to a 10 kilocalories per day reduction per person. And there's a question if this small absolute number have an implication at the population level. This is something that we are trying to address on our next steps that are related with decision modeling and also distributional effects. So how these effects that apparently are much more important in the high socioeconomic groups could affect equity in terms of health outcomes. And this, I think, should be something to take very seriously in consideration as a pre-implementation step when a policymakers decide to include or not such a tax within the country. And our current work and next steps that I already have been talking a little bit, we are conceptualizing a model trying to address the long-term effects of the implementation of such taxes. And in generally, when we see the literature, this is the a skeleton of any model that try to address this question. So in yellow, you have demand models that try to link the change in the tax and prices to differences in purchasing of the population. From this, you make some assumptions in terms of how differences in purchasing relate a difference in actual consumption of the population. And from consumption, you go for energy balance models that try to estimate what should be the expected change in the BMI of the individuals and the population. But also you have other non-caloric pathways that link consumption to, for example, blood pressure, glycemic, and other relevant factors that could lead to an increase in incidence and mortality of different diseases. We are around time, so our next steps are related with this, and we are interested mostly in two questions. First, does really a small absolute change in consumption makes any impact in the health of the population? So that's one question. And secondly, how these potential impacts distribute within the overall population. Is this policy or have this policy the potential to reduce inequalities in terms of non-communicable diseases, for example, or by the other hand, it will increase the inequalities that we observe? And maybe a third relevant question is what could be an ideal design for the tax, because you have different ways to implement it. You can have an excess tax that is based on a flat rate, like in Berkeley or Mexico, where you have a monetary amount per volume or per sugar content. That's something different. And third, you have the possibility to have a tax based on the price of the product, like in Chile. You could have only one tax rate, or you can have tiered ones like Chile has implemented. And so far, it's not clear if some of these approaches could bring better outcomes in terms of reduction of consumption, especially from high consumers of sodas and also high body mass index populations within the countries. Well, that's what I wanted to share with you, and hope that we will have some time now to talk for some of these points that could be of your interest.
Does anyone have any questions for Cristóbal?
So with the tax that's been raised from the sugary drinks, is there any kind of policy initiative as to what to do with that money that's being raised from taxation, such as cross-subsidization for healthy foods? So then that way you can increase the price disparity.
Yeah, that's an excellent question. And in several countries, it has been an issue of discussion. For example, in Mexico, the money that is raised, at least a part of the money raised from this tax, is used to increase the availability of safe water. So, for example, they have a program where they build within schools places for drinking safe water across the country. Mexico still have like places where safe water is not available. So for them, that was really, really a priority. In case of Chile, there is a problem that is in our constitution. It's forbidden to have any bill that raise money linked to another bill that use that money. So the parliament could not decide to use directly the money from one levy to any other use, but all the money is raised, and then you have a discussion every year of how you are going to use all the money. So in the case of Chile, it's something that could happen, but needs to have these two steps. So it's not possible to link it by law.
Thank you. May take a talk about how the actual price of the soda and non-soda products after the taxation process actually, because like the price have an impact on the consumption, is right, but I just want to know what is the impact of the amount of money that has been increased due to the taxation system. Like having a regressive kind of taxation is important.
The revenue,
yeah. I mean, it's the actual price which matters in consumption.
Yeah.
If you add 10% on $1 price, the rate of change is very minimum, and it wouldn't have an impact on the consumption.
Yes. The increase, as I showed, for example, for carbonates was around 5%. This 5% increase for a soda can that it costs around $1, for example, you can do the math. So there are small increases. And there is some rationale and there is some theoretical work also that makes the point that if you really want to decrease and curb down consumption, the taxes need to be from a certain amount. So there is like kind of a magic number that the World Health Organization is pushing forward, that is 20%. Because on most of the theoretical models, when you pass the 20% increase, then you see larger decreases in the demand. So you don't have linearity in terms of the demand of the population. And that makes the point for the government to try to increase their taxes more substantially if their aim is to reduce consumption. That's another interesting discussion because for several countries, such policies are revenue-generating policies and not health policies. So when you design a tax to increase revenue, you try to keep your tax rate lower and increase your tax base. So then you are going to have an increase in returns and you are not going to affect that much the demand. So you maximize your amount of money raised. That's a different approach from a health perspective tax where you want to curb down consumption. And that was a discussion in Chile, for example. And like the Treasury didn't want to rise more because from their theoretical studies, they were expecting that the revenues will start getting down.
I have a question from a person online, from James Bowen. His question is, were there any government advertising campaigns that accompanied the taxation implementation?
No, and that's something interesting that compares the case of Berkeley, Mexico, and Chile. because in both Mexico and Berkeley, the tax was a very, very important discussion. So you have like in all the news, like the industry that was lobbying very strongly and advocating. So it was a very important thing in the political agenda. In the case of Chile, I mentioned it shortly, this tax come into a very large tax reform where this tax was really unimportant related with all the other changes that occurred. So because that, the public discussion wasn't within this tax, but in, for example, corporate taxes. And when you ask most of Chileans if there is a soda tax in the country, they are not aware of it. So it's not really something related with the awareness of the policies that will explain the results that we see.
I thought you had a good rationale for why you selected sugary drinks in particular for your research. And I'm just curious if there have been dialogues about other foods potentially to include, to potentially tax, and what those foods might be.
Yeah, the discussion in this is like the first division is you go for nutrients or you go for products. So then you have a struggle. Yeah, we are going for sugar or you are going for a specific product. I have been part of an advisory committee for the government last year where we analyzed this and we make some recommendations for the government. So we analyze different kind of approach. The ideal way of doing it in an economic perspective will be nutrients. So you have like tax for each gram of sugar, each gram of salt, each gram of saturated fat, and you calculate at exact tax rate that compensates the externality of the consumption of each unit. That is the ideal way of doing it from an economic perspective. The problem is that it's not as feasible to implement because of the way how you collect the money and how you make sure that companies are paying what they should pay. You will need to invest a lot of money to enforce that kind of tax. So if you go to the other way, you can focus on categories of products. So soft drinks, of course, but probably what is most interesting is the ultra-processed food products. So nowadays we have like reasonable good ways to classify products, find quite a simple way of classifying it. So we can have a tax on all the ultra-processed foods. And in the case of Chile, we have a labeling law, and this labeling law identifies most of ultra-processed foods and is already implemented. So a very straightforward way to have a broader tax will be to have a tax on all products that are labeled as unhealthy. That's something that could be followed by other countries as a simpler approach than the nutrient way that could be ideal, but it's not easier to implement.
In your fixed effects model, how are you getting the consumption effect versus the income effect? Because if you're saying this is like part of a larger tax change,
yeah,
how do you know you're not capturing a change in like income versus a change in the relative price?
Yeah, the assumption in the fixed effect is that the income is for each household is stable in time. And that is an assumption that is reasonable in short periods of time. We take a 3 years period of time of analysis, so that it could be a bit in terms of the analysis, but we tested also alternative models with mixed effects and also random effects, and our results didn't change substantially. But yes, there could be some income effects also in terms of the long-term changes that we are seeing.
You mentioned that there was a large tax reform. Do you know if there were any other products that were substantially had a change on their taxation that could also impact the consumer habits for the entire
beers. Beers was another product that was increased the price. So there was some discussion within the team if we should include like beers within our analysis or not. We ran some analysis and we saw also some small changes in the price of beers, but without substantial changes in terms of the consumption of it. Finally, we didn't report it in our like published paper, but yes, I think that's the probably most relevant product that has been taxed. All the other taxes were related with like green energy taxes, like not related with food directly. Of course, you can make the point that if you raise taxes in some point of the economy, like the overall cost of production could change, and that could impact some products. And for that, we took some unrelated products as controls, because if we assume that corporate taxes, for example, increases, we assume that that taxation affected across all companies within the country and not just soda drinks companies. So using that controls, we tried to adjust for other potential effects of other taxes that were coming within the policy.
Any more questions? Well, thank you very much, Cristóbal, for coming and speaking at our round.
Thank you very much.